I want to officially welcome everybody to this event. My name is Derek Anderson. I have had the privilege of serving as the president of this hospital. It has been an honor to shepherd this hospital, and one of the programs that I very early on was introduced to, of course, was this program. And if we just take a minute and look around, there are easily 80, by my quick count, 80 of us in the room. There are thousands beyond the walls of this hospital and this event who have been impacted by this program and impacted by the vision of one family and one woman. Marian and her family have poured so much into this program over the years. And tonight is a celebration of the center and the work that's done and the team. But I'm going to also say this is a celebration of the work, Marian, that you have led us through.
Yes.
I think we all know this. You cannot build a program without a champion. And we've had you as our champion and coach, and continue to have you as our champion and coach. You're not getting away that easily.
I thought 20 years I could turn in.
Nope, we're going to be here celebrating in 40 years.
Yes.
But just an incredible welcome to all of you who have traveled near and far, local, out of state, wherever you're coming from. We are so grateful that you're here celebrating with us tonight. 20 years, it feels like a lot. Time goes so quickly. But what we're celebrating really is the people and the lives and the families that our coaches and our volunteers and this center touch, not just here, but across 29 other replicated sites across the country, including major academic centers. So what started as perhaps a simple idea here, this is how all great things happen. They spread and they do good work. So with that, just a huge welcome, a massive congratulations to the team in the Caregiver Center, Ellen and Shifa, Jill, and the team that have been doing this every day for many years. And so with that, I want to hand off to Marian.
Welcome, everybody. And thank you, Derek. That was really beautiful. Reflecting on the genesis of the Caregiver Center, I vividly recall the profound stress of caring for my beloved Ken over 2 years. Despite receiving excellent care across 4 different hospitals in the New York area, I constantly felt at my wit's end with nowhere to turn. After his passing, I was determined to honor him, and so the idea of a dedicated caregiver center within a hospital was born. The vision could not have become a reality with those who saw the promise from the very beginning. Thanks to Patty and Mike Koizum, my dear friends, for their encouragement, and Vicki and Fred Feiner, who believed in the concept and offered invaluable moral support during our first meeting at Northern Westchester Hospital. Thank you so much. But most of all, my profound gratitude extends to Jill Seligman and the administrators. Jill, where are you? Come up here, please. They understood the vision before it was proven, recognizing the vital importance of supporting caregivers long before such support was commonplace. Their trust planted a seed for everything that followed. Okay, you can sit down. I also want to thank Barbara Becker and Nancy Herbert, I know you're here, wave, for joining me with as the first volunteers and taking that leap of faith with this new program. Shortly after, Jerry Rosenfeld took the helm as our social worker in chief. She helped shape the center into a model of empathy, advocacy, and practical support working alongside countless devoted volunteers whose generosity has sustained our mission. And truly, we have the best volunteers imaginable. With Jerry's retirement in 2023, we were incredibly fortunate to have Ellen Travers step into the leadership. With Sheepa Lulinai at her side. Together, these wonderful women continue the essential work with wisdom, warmth, and unwavering dedication. Looking back, I always remember the first time I walked into a patient's room and explained that we were there to support the caregiver, emphasizing that when somebody gets sick, it impacts the entire family. That caregiver was utterly surprised, asking, "You're here for me?" She couldn't believe it. Then she proceeded to pour her heart out to me. And in that moment, I knew we were onto something big. And that reaction continues to this day. As we celebrate tonight, we have the privilege of embracing caregivers during the most challenging days of their lives, like supporting young children as they say goodbye to their beloved mother, planning weddings and birthday parties to bring joy at a time of heartbreak, standing shoulder to shoulder with a family on an honor walk as their loved ones become a multi-organ donor, and fulfilling the last wishes of a patient yearning to be buried in their homeland. And that's just to name a few. Much to my surprise, this center has evolved into something far grander than I had ever imagined or could ever have imagined. In 2009, Midlands Michigan Hospital replicated our model, and Montefiore quickly followed suit. Today, I'm proud to announce that there are 29 hospitals with caregiver centers across the U.S. I'm so proud and pleased that some of those replicated sites people are here. Thank you for making the journey. Okay, where was I? Okay, one of our replicated sites, the Mayo Clinic in Arizona, recently published a research paper substantiating the immense value of caring for the caregiver. We are deeply grateful for their significant endeavor. And now we are thrilled to be working on spreading our model internationally. With Jill Gottlieb as our dedicated replication coordinator, our ultimate goal remains ambitious: a caregiver center in every hospital. With over 63 million caregivers in this country, a number that continues to grow, we know this work is more important than ever. We are proud to share that through the generosity of our donors, and many of you are here today, and I thank you so much. The Caregiver Center services are entirely free of charge, including to any community members in need. And for those of you who haven't been to our newly renovated Caregiver Center in the lobby, I really hope that you get to see it. Though they didn't want me to say this, okay, but a special thanks goes to Ellen, Sheepa, and Jill for this wonderful celebration and the compassion they show every day. And we have them. They are truly a remarkable team, along with our volunteers. It's just, couldn't ask for anything better. So in closing, my heartfelt thanks goes to every volunteer, social worker, hospital partner, donor, and caregiver 20 years is a monumental milestone, but even more, it is a promise. A promise that we will continue to listen, to support, to stay connected, and above all, to care. Now I'd like to introduce my daughter, Ashley. Some of you might know her. Who, with her sister, Michelle, who unfortunately could not join us tonight, she's down in Maryland, has joined the KHCC team, ready to carry on the legacy. So wonderful.
Thanks, Mom, as always, for your beautiful and thoughtful sentiments. To say I'm proud of what the center has become and of you would be an understatement. I was 14 when my dad was diagnosed with cancer, and I wasn't in any position to help my mom in the caregiver role. Truly, I was probably more of a headache. After all, I was 14. But we all saw the immense weight she was caring for my dad and for us, and how much she could have used the kind of support our center provides today. I remember her sharing stories of those incredibly difficult moments, crying alone in the hospital stairwell because she had nowhere else to go, struggling to communicate with doctors, or feeling like she couldn't even leave the hospital just in case something happened, with no one to turn to. How she could have used an advocate in those moments. The day before my dad died, a nurse brought us into a very small, sterile room. I sat on the floor, and I was told it was time to say goodbye, that my dad was going to die. And then she left. Nothing will ever change the magnitude of that moment and how heart-wrenching it was, but knowing that families now have an oasis in the hospital, one that can make even the hardest moments just a little bit more bearable, is extraordinary. My mom always told my sister and I, you have to be able to reinvent yourself. And if this isn't the definition of that, I don't know what is. I think I speak for everyone when I say we are all so grateful you paid it forward. Thank you to everyone who has made tonight and the past 20 years possible. I know my dad would be immensely proud of this milestone. Now I'd like to share a poem that one of our former volunteers shared with us, one that feels especially meaningful tonight. 20 years, not counted only in calendars, but in quiet moments held together, when someone thought they might come undone. It began as an idea, a spark carried gently, that saw what others missed, that caregivers too need care. At Northern Westchester Hospital, amid the rhythm of healing and urgency, the Ken Hamilton Caregiver Center became a pause, a breath, a reminder that strength does not mean standing alone. Here, burdens are spoken aloud and somehow made lighter. Here, tears are not hidden, and neither is laughter. Here, resilience is not demanded, it is nurtured. 20 years of stories, of hands held, of shoulders shared, of voices saying, you are not alone. And perhaps that is the truest measure, not the years, but the countless lives steadied because someone cared for the caregiver. So today, we honor not just time, but tenderness made tangible, a vision carried forward, a community sustained, a quiet, enduring grace.
Hi, everyone. Our next speaker, we are delighted to have Agnes Barden with us. And she's just going to share her reflections on what caregiving means to the Northwell system. And we so appreciate you being here, Aggie.
Thank you, Marian, for your words. Thank you, Ashley, for your story. It has been something that has motivated so many of us across the organization. This happens to be Patient Experience Week. So what a better place to celebrate 20 years of an amazing program. I'm going to start out by saying, just reiterating something you mentioned earlier about stories. And you said it's all about the stories, and we all have them. And if I were to ask people in this room, how many of you have been a caregiver? I'd like you to raise your hand if you've been a caregiver. Look at this number. This is incredible. And if you've been a caregiver, you have that story. And it takes you right back to the emotion. I remember graduating from college, and I was moving to Washington, D.C. to work at George Washington University Hospital, and my father had a massive stroke. And what happens when that happens in a family is it changes everything. That decision had to be unchanged, and I had to make a new decision, and I had to take a job in New York City. Years later, I became a mom, and I had 2 little boys. That's why I love these little boys. Watching you just really makes me feel at home. And so I remember having a 6-week-old and a 3-year-old. And my mom had a stroke, massive stroke. And again, the world changes from everything you had. And you try to pick up the pieces and say, like, feel what you're going to do. And I'm a nurse, and in my family, I became a point person. And many people in healthcare become those point people. And I remember at one point during that journey, I was caring for my mother, caring for a baby, caring for a toddler, trying to work and be a good wife and mother. And at one point, I remember going into one of the rooms with a diaper and something for my mom, and I forgot what I was giving to who. And I got so anxious, I just stopped and I went to the closest room, which happened to be the bathroom. I went to the bathroom and I climbed into the tub. It wasn't with water in it. And I just sat in the tub for a few minutes. And I remember thinking, I'm so overwhelmed. I don't know what to do. I don't want to fail at anything I do. I want to be good. I want to be perfect at it. And I realized that I needed help. And so years later, working for Northwell, an amazing hospital, Northern Westchester, became part of the Northwell family. And I remember coming up and meeting Joel and Marla and Lorraine and Maria. And I remember seeing this Ken Hamilton Caregiver Center. And I was like, what is that? And I immediately was totally connected to the purpose and mission of what it was about, having been on that other side of the bed and knowing what it's like to be the caregiver. And so I got to meet Marian. I got to meet Jerry. I got to meet Jill. And we started this partnership of how can we do this in our organization? How can we really care about the patient and family all through Northwell? Because when someone gets a diagnosis, as you said, everybody gets the diagnosis. And so we started this amazing work. And it started in 2018 with an amazing woman who I know is in the audience. I don't see her. Tara Englund, are you here?
She's here.
She's here, right? She's here. So Tara Englund is the Vice President of Patient Experience for Conic Bay, and she had also heard about our work in patient experience, and she actually came up and met with Jerry, and Tara is way out at the East End, out by all the vineyards. And so that was the first hospital in Northwell that began the replication process, right? But from there, because we're such a close-knit group at Northwell, how could you have that? We want to have this too. And it began spreading. So I know you mentioned a large number of applications you have done, but 12 of them are at Northwell across our entire organization. So I happened to be at Phelps Hospital this morning for Patient Experience Week. I was in their Caregiver Center. I was at Peconic Bay a couple of days ago. I was in their Caregiver Center. I was at LIJ. I was in their Caregiver Center. And what's really amazing is that our hospitals are embracing this because we know the caregivers are the people that need that time. And I just want to thank you for your vision, for this ripple effect you have across an organization, us alone, 12 caregiver centers, all because of your dream. And it's something that makes such an impact. I cannot tell you when I see the families what it means to them, so they know they have a lifeline. So I just want to thank all of you for being here to share a very extraordinary person and family who had a vision, who went ahead and did it, moved it forward, and now it's rippling across a community serving so many areas and communities. So congratulations on your 20-year anniversary. We're really, really grateful that you've been a part of our lives. Hopkins, who has been a caregiver, who has actually been here as a caregiver, and was treated and exposed to this amazing program, and now is a Ken Hamilton certified coach. So I'd like to bring you up, and it's been so fun meeting him. Thank you. Thank
you. My name is Keith Hopkins, and as you heard, I'm a caregiving coach at the Ken Hamilton Caregiver Center. I became a caregiver for my mom after she was diagnosed with Alzheimer's disease and a few stints and stays here at this hospital. Adrienne was a caring and devoted mom. She loved a great celebration. She created celebrations, but she made sure that her family members were the one that always were basking in the light. we celebrated Halloween like nobody's. All I could ever ask for her and for my mom was one good day. But I also knew as a caregiver, there were no days off. My first encounter with the Ken Hamilton Caregiver Center was outside of the ICU room, 2001, when Shipa and Lisa approached me, and I immediately knew that these were services that would help me and my family. I signed up for all the programs right away. I participated in a support group, monthly, led by Ellen, and I started with the Stay in Touch program where Lisa would call me every 3 weeks. And even when we couldn't speak and she left a voicemail, those voicemails were like a lifeline. So thank you. My mom's care team consisted of myself and 4 other family members. We created this caregiving mosaic to try and fill in her declining and ever necessary needs. After several visits here and stints in short-term rehab, we knew we needed to engage home health services. She would stay with my mom from Monday through Thursday, and we couldn't find any reliable support for the weekends, so I stayed with her each weekend. They say that there's no better teacher than adversity, and as a caregiver, every day felt like adversity to me, my team, and my mom. I would often reflect, instead of lamenting for her or for me, what is this supposed to teach me? That reframing helped me immensely. During the final days of my mom's life, we made arrangements to transition to hospice. On October 26th, when I entered her condo, the hospice nurse was arriving to admit her. They were bringing a hospital bed. But as soon as I walked through the door, I knew that was not going to happen. For the next hour or so, I sat next to my mom and held her hand, speaking to her softly. She gave me the second greatest gift of my life, when I was able to bear witness to watch her very last breath. She died as she lived, with grace. Arrangements were made, and she was laid to rest on 10/31, Halloween. You see, 10/31/34 was her birthday. And when she was asked healthcare's most fabulous question, what's your date of birth? It was a great conversation starter, to say the least. A while after my mom passed, I participated in the Caregiving Center's bereavement support, which was led by Michelle Bazzoco Hamilton, Marian's daughter. Our small group met with her for about 8 weeks, and when we shared our contact information, we had a monthly Zoom session for almost 1 year after that. The texts kind of stopped, our lives had moved forward, but we had served a purpose for each other. Recently, on my day of rounds, Ellen met a family whose loved one had passed in the ICU. When I arrived in the ICU, the staff informed me that their family was in the room with the curtains drawn. Now, as an experienced caregiver coach, I pulled back the curtain and walked back into room 2001. I worked with the staff and the family to facilitate questions, ideas, concerns, so the family could move forward. The staff was very appreciative and the family was very appreciative. And I walked out of here, like I always do on Thursday, knowing that I made a difference. So that's my caregiving story. And as you heard, I want you to understand that there are 63 million other caregivers here in the United States. I'd like to thank you all for your time and attention. And if anyone finds themselves in a caregiver role, you know that we here at the Ken Hamilton Caregiver Center are happy to help. And all I can wish for you all and any caregiver is one good day. Thank you. So with that, I will turn it over to our fearless leader, Ellen Travers.
All right. Hi, everybody. For those I have not met, I'm Ellen Travers, and it's my privilege to be the program manager for the Ken Hamilton Caregiver Center. Keith, thank you again for your story and your service. As we wind down this presentation tonight, we have one very special group of people to thank and acknowledge, our caregiver coaches. From the beginning, from 20 years ago to today, 53 individuals have been called Ken Hamilton Caregiver Center coaches. These coaches have been the engine that powers the Caregiver Center. It enables us to proactively seek out caregivers and meet them here on our campus, but also in the community at Chappaqua Crossing, in our cancer center. All across our community, we want to meet caregivers where they are. The coaches are carefully handpicked. These incredible human beings bring their professionalism and compassion to our families and our patients every single day. Here's a big number for you. Due to their commitment, we have been able to support over 110,000 caregivers here at Northwell Health. Here tonight, you're part of those metrics. You are part of those numbers, and we thank you from the bottom of our heart. As a team, we deliver on our mission to support, inform, and embrace caregivers in need. Caregivers here in this building feel seen and heard, and their concerns are always validated. What a powerful message to send to our community. The coaches of the Ken Hamilton Caregiver Center, in my opinion, make this hospital shine. And we're deeply grateful to all of you. Right now, I'm going to read the names of all of the coaches that are here in attendance tonight. I ask you to please stand when your name is called, and we'll hold our applause until the end, because they all deserve a big round of applause. Ann Seda. Alice Seda, I'm so sorry. Ann Stafford. Bobby Goldstein. Bonnie Cubell. Cecilia Vega. Christine Sotnery. Craig Miller. Bill Lopiano. Dee Dee Burke. Eileen Gattano. Ellen Grosbaum. Helen Berman. Jill Troso. Julie Vaupin. Katie Cates. Keith Hopkins. Lisa Pizzolato. Luann Morris. Lynn Bork. Marissa Kornblau. Nancy Herbert. Nori Lustig. Patty Coyson. Ron Melter. And last but never least, our Jerry Rosenfeld, the coach who taught us all how to be coaches. Thank you all so much. We absolutely could not do our work without you. And we're so glad that everyone can be together tonight and celebrate this milestone. That concludes our program. On behalf of the Hamilton family, please enjoy our refreshments, and again, we have our deepest gratitude for being here with us tonight.